If you're choosing your own health insurance plan, whether you're self-employed, buying coverage through the marketplace, or just trying to make a smart financial decision, it's really easy to make expensive mistakes. There are so many plan options and the cost can be confusing. And if you choose the wrong one, it can end up costing you hundreds or thousands of dollars over the course of the year. And when health insurance is already such a major expense, the last thing you want to do is pay more than you need for coverage that doesn't actually fit your needs. So in this video, I'm going to walk you through 4 costly mistakes and how to avoid them when choosing a health insurance plan. Hey, I'm Shamy. I'm a healthcare finance consultant, and this channel is all about helping you understand your health insurance to save money. So if that's something you're interested in, please subscribe down below. Mistake number 1 is only looking at your premium. And I get why. It's the number that hits your bank account every month, and for most people, it's the only consistent healthcare cost that they're incurring on a regular basis, and it is a significant cost. It's the sticker price of your plan, so it's a very important number. And naturally, that leads people to just pick the cheapest one. But that can really backfire on you quickly because your premium is only one part of what you might end up paying for healthcare costs during the year. You also need to pay attention to your out-of-pocket costs, and that includes things like your deductibles, co-pays, co-insurance, and out-of-pocket maximum. Because sometimes the plan with the lowest monthly premium ends up being the most expensive plan overall once you actually use it. And that makes choosing a health insurance plan based on premium alone kind of like booking the cheapest plane ticket you can find. Let's say that these 2 piles represent the cost of a plane ticket to fly to Paris. At first, this smaller pile looks like an amazing deal because the fare is really low. So you pick this pile, but later you find out you have to pay for a whole bunch of extra things like picking your seat, adding additional weight that you need to your luggage, and eating basic snacks on the airplane. And so suddenly this small pile doesn't look so small anymore, and what originally looked like a higher airfare is actually the least expensive options because all of those additional things you're paying for with the lower airfare are included in this pile. So just like with health insurance, the lowest premium doesn't always save you the most amount of money. And a better way to understand what healthcare costs might actually cost you in a year is to look at the broad range of possible expenses. Now, the premium is the least amount you're going to spend, and the ACA compliant plans include certain preventative services at no additional cost to you, like certain vaccinations and screenings, which I'll pop a link down to in the description below. Now, the premium plus the out-of-pocket maximum is the most you'll pay in a plan year for covered services, but most people actually pay in between these 2 numbers in a given plan year. Mistake number 2 is not taking the time to really assess your healthcare needs. A lot of people just pick the plan they had last year. Maybe you liked it, so you think you'll just stick with it again this year. And that seems fine until you realize that your needs change from year to year, or maybe you never really knew how to tell if that plan is actually the best one for you. Either way, just blindly picking the same plan you had last year without assessing what you actually need can leave you underprotected or leave money on the table. Maybe you were really sick last year and are anticipating fewer doctor's visits this year, or maybe you're planning a big procedure this year, starting therapy, adding a prescription, or even thinking about adding a baby to your family. Evaluating your actual past healthcare usage is a good starting point to selecting a plan that meets your current needs, and there's a simple way to do so. I want you to look at your last year's explanation of benefits, or EOB for short, which will tell you what you paid in deductibles, co-pays, and co-insurance. Let's break this down with 2 scenarios, one where you met your deductible last year and one where you didn't. We'll look into each one to figure out whether it makes sense to stick with the same plan or consider switching to a different plan based on your past spending and expected healthcare needs. Now, a quick reminder that this is a high-level overview only to help you think about choosing a plan. Everyone's situation is different, and your specific healthcare needs, plan options, and costs may vary. You may also need to consider other factors like the network coverage, prescription benefits, or special programs, and consider consulting a licensed insurance professional. If you didn't meet your deductible last year and expect a similar or lower healthcare needs this year, a higher deductible plan with a lower premium could save you more money because your costs are low and insurance won't start paying until you hit that higher threshold. And since you didn't meet it last year, you're probably not going to meet it again this year, so you might as well save money on your plan. But if you expect higher expenses this year due to more visits, procedures, or prescriptions, then sticking with a plan that has a lower deductible makes sense because once you meet that deductible, insurance will start covering your costs. In the second scenario where you met your deductible last year and you still find that you spent a lot on co-pays, co-insurance, it might make sense to buy a plan with a higher premium. It'll cost you more monthly, but the amount you'll pay out of pocket will be lower. Conversely, if you expect less medical expenses this year, then a higher deductible plan with a lower premium might make the most sense. By identifying which scenario you fall into, you can make smarter comparisons between plans. Now, mistake number 3 is not checking whether your providers are in-network. When people are comparing health plans, they're usually focused on the financial aspect and forget to ask a really important question. Is the plan in network with the doctors I want to see? And that matters because if you have doctors and hospitals that you know and trust, you want to continue seeing them at a lower price. And if they're not in network, you want to be prepared for 3 alternatives, which include switching to different providers that are in network, continuing to see your current providers at the higher out-of-network cost, or selecting a different health plans where your providers are in network. And none of these options are inherently wrong, but the mistake is not realizing you may have to make a trade-off before you enroll. So before choosing a plan, take a few minutes to ask yourself, do I care if I have to switch doctors? Would I be okay seeing a new specialist? And am I willing to pay more to keep the providers I already have? And one more thing, don't assume that because a provider accepted your insurance last year means that they'll automatically be in network this year. Networks can change, doctors can leave the networks, hospitals can leave the network. So when you're renewing your coverage, this is something that you still want to double check every year. And if you're not sure how, here are a few easy ways to do it. Look them up in the provider directory on the plan's website, call the insurance company and ask them to verify using your provider's name and contact information, or call your provider's office directly and ask if they participate with a specific plan. So before you choose a plan, don't just ask, how much is this plan going to cost me? Ask, does this plan work with the providers I actually want to see? And if not, what am I willing to do about it? Because sometimes the trade-off isn't just premium versus deductible. Sometimes it's lower costs versus keeping the care team that you know and trust. Last but not least is mistake number 4, which is not checking prescription drug coverage. And this is a mistake that can get expensive really quickly because prescription drug costs are one of the most expensive healthcare costs in the US. So if you take medications regularly, this is not something you want to gloss over when choosing a health plan. Every health plan has its own drug formulary, which is the list of medications that the plan covers. And they usually outline drugs that they cover by tiers, such as generic, preferred brand, or non-preferred brand, with out-of-pocket costs being the least expensive for generic drugs and the most expensive for non-preferred drugs. So before you choose a plan, you want to know if your medication is covered, what tier is it in, and here's how you can check out that information. You can look it up online by researching the drug's formulary on the plan's website, or you can call your health insurance company with the plan name and the prescription drug, and they can confirm coverage for you, in addition to restrictions like prior authorization. This information also helps you plan smarter for the year because knowing whether or not your prescriptions are covered and how much they might cost you can inform how much to contribute to your FSA or HSA to make those purchases a little bit more affordable using tax-free dollars. That way, you're not just choosing a plan, you're also thinking ahead about how to budget for healthcare costs that come with it. If you want to learn more about choosing the best plan for you, check out this video right here, or drop a comment down below about other topics you'd like me to focus on. Either way, thank you so much, and I'll see you in the next one. Bye!